Hello students, welcome to Medicine Guruji, a yet new lecture on diagnosis of diabetes. I am your mentor, Dr. Awadh Kapoor. I will discuss today how to diagnose a case of diabetes. There is a well old saying, life is not over because you have diabetes. Make the most of what you have and be grateful. First, we will see what is a clinical presentation of diabetes. जब भी हम कोई पेशेंट देखते हैं ओपीडी में, इमरजेंसी में या कहीं पे भी जहां हम अपने पेशेंट्स पे वर्कआउट कर रहे हैं, सो अ वास्ट मेजॉरिटी ऑफ पेशेंट्स, अ बिग पूल प्रेजेंट्स एज एसिम्टोमेटिक केसेस ऑफ डायबिटीज. कैसे डायग्नोस होता है? किसी पेशेंट ने रूटीन इंश्योरेंस के लिए अपने फुल बॉडी चेकअप कराया है या डॉक्टर ने किसी और प्रेजेंटेशन के लिए कोई जांच कराया है और पेशेंट कहता है डॉक्टर साहब देखिए मेरी शुगर बढ़ी आई है. सो अ वास्ट मेजॉरिटी ऑफ पेशेंट्स प्रेजेंट एज एसिम्टोमेटिक केसेस. Another group is the classical presenters of diabetes, that is increased thirst, प्यास बहुत लगती है, पॉलीयूरिया, यूरिन बहुत जाना पड़ता है जल्दी जल्दी, एंड आई एम लूजिंग वेट, वेट लॉस हो रहा है. पॉलीफेजिया, दिस इज अ सिम्टम कार्डिनली सीन बाय इंडियन हाउसवाइफ्स. वाइफ्स कहती हैं साहब अब ये हमारे हस्बैंड जो पहले 2 रोटी खाते थे अब 4 से 5 खाने लगे हैं, और मैंने नोट किया है जब से इनका खाना बढ़ रहा है इनके थकान और बढ़ रही है. दैट इज क्रॉनिक फटीग. पेशेंट ये भी कहता है कि डॉक्टर साहब मैं सुबह सो के उठता हूं और सुबह से ही थका रहता हूं. रिकरेंट इन्फेक्शंस, कोई भी छोटा मोटी चोट, फोड़ा फुंसी देर से भरती है और जल्दी जल्दी इन्फेक्शंस होते हैं. Whenever we see such symptoms, we suspect of diabetes. So, what is diagnosis of diabetes? A casual venous plasma glucose greater than or equal to 200 milligram per deciliter is sufficient for a definite diagnosis of diabetes. But in an asymptomatic person, you have to remember if there are no symptoms with moderate hyperglycemia, you should undergo a second confirmatory test. That is very essential because once diagnosed, patient has to bear this burden of drugs for his whole life. What are diagnostic tests that by which we diagnose diabetes mellitus? First is fasting plasma glucose, that is value is greater than or equal to 126 milligram per deciliter. Plasma glucose after a 75 gram glucose load, that is ideal, or in random sample is greater than or equal to 200 milligram per deciliter, and HbA1c values greater than or equal to 6.5%. Students and interns and JRs kindly learn this slide. Now students, look at the pre-diabetes value. Impaired glucose tolerance. The impaired glucose tolerance in these, the fasting glucose is between greater than or equal to 100 milligram per deciliter to less than 126 milligram per deciliter. 2 hours post glucose load, that is 75 gram glucose load, greater than or equal to 140 milligram per deciliter to less than 200 milligram per deciliter, and HbA1c between 5.7 to 6.4%. Now there is another term, that is impaired fasting glucose. That is only the fasting is disturbed. Fasting plasma glucose is greater than or equal to 100 milligram per deciliter to less than 126, and 2 hours post glucose load plasma glucose is less than 140 milligram per deciliter. So the point to note here is only fasting is disturbed. Now look at some important points. Due to day variability of blood glucose measurements, it is important that the diagnosis of diabetes be made only when two abnormal values have been found on separate days. That is, in asymptomatic individuals, except when there are presence of cardinal symptom and signs. What I explained you, polyuria, thirst, and WHO tells that oral glucose tolerance, if impaired fasting glucose is present, is must. WHO advocates the oral glucose tolerance test if impaired fasting glucose is present. A complete 75 gram 2 OR oral glucose tolerance test should be done. How to perform an oral glucose tolerance test? There are few points you should remember. Unrestricted carbohydrate diet for 3 days. Fasted overnight for at least 8 hours. Rest for 30 minutes. Remain seated for the duration of test. He should not walk or run or do jogging, with no smoking, and measure plasma glucose before and 2 hours after a 75-gram oral glucose drink. WHO advocates the use of 75 gram of glucose. In few international books, there are written as dose as 50-gram glucose, 100-gram glucose, but we have to go according to the WHO norms. Look at these few charts. Diabetes is when fasting is more than or equal to 126, 2 hours after glucose load is greater than or equal to 200 milligram per deciliter, and HbA1c values are greater than or equal to 6.5%. Look at the value of pre-diabetes. Fasting more than equal to 100 to less than 126. Kindly learn these values. 2 hours after glucose load greater than equal to 140 to less than 200 milligram per deciliter, and HbA1c value 5.7 to 6.4. What is impaired fasting glucose? Fasting 100 to 126 milligram per deciliter and 2 hours after glucose less than 140 milligram per deciliter. Important points to remember. Now we are coming to end of these slides. Glycemia can be classified into three categories: normal, impaired, and diabetes. The glycemic cutoff that defines diabetes is based on a level above which there is risk of microvascular complications. Asymptomatic individuals should have a second confirmatory test. Never forget this. And pre-diabetics are at less risk of microvascular complications. So we should be very careful when we have to start the drug treatment. Thank you. Thank you, students. Have a golden career ahead.